Some new models now show Arizona's coronavirus may not happen until late May or possibly early June. But overall, we do have the capacity to care for those patients. ABC 15 investigator Melissa Blazey is reporting live for us tonight on those projections and, of course, how the most vulnerable are impacted here. Melissa.
And Katie, you do have to look at all of these projections with a little bit of skepticism because the models have varied in huge ways over the last few weeks, in part because they're based on limited data, known positive cases, hospitalizations, and deaths. Now, Arizona State Health Director Dr. Kara Christ did release finally an Arizona model created by local university professors. ABC 15 has been asking to see this model for literally weeks. Today, we know what it shows, that we've hit a peak in healthcare needs now on May 22nd, it believes, with the need for about 600 hospital beds and 300 ICU beds. That's their middle of the road projection. A projection that they also were talking about today from the federal government says that we would have a peak on June 11th, a much later date than earlier projections. But all of these things show that there would be significantly fewer hospitalized patients and hospitals would not be overwhelmed.
Those numbers have changed dramatically, and I would say they've changed dramatically for the better in Arizona.
Likely plateau as we continue to go, but it's very hard to determine what's going to happen if you have like a special condition in a community.
And we've seen some of those special conditions in a community, like the outbreak on the Navajo Nation, and also outbreaks in congregate care facilities, things like nursing homes. The governor is saying that he is concerned about the vulnerable populations in these long-term care facilities, saying relatives of patients would be told if their loved ones tested positive for the virus, and that they're working with federal regulators on telling patients about outbreaks in their facilities in general. But the governor and Dr. Chris standing firm that it would be a violation of health privacy laws if they did report the names of those nursing home facilities with outbreaks publicly into the general public. Reporting live in Phoenix, I'm investigator Melissa Blazey, ABC 15, Arizona.